Picis, a leader in high-acuity solutions, has created the world's most complete emergency department information system. Picis ED solutions help enable staff to reduce wait times, speed patient flow, and improve charge capture and documentation.
We determined that it would help us best with our number one challenge, and that was managing patient flow and clinician flow within the ED.
The reason Abington bought ED PulseCheck was we were looking for an operating system that we could bring into the emergency department that would incorporate patient tracking, discharge instructions, nursing documentation, physician documentation, and bidirectional order entry and results.
Improving throughput means reducing wait times, which boosts patient satisfaction. But to speed the flow, you need trustworthy information to track and treat all patients.
We have dramatically, by over 1 hour, decreased door-to-doctor time. We also have a goal to have all patients triaged in 15 minutes or less by the nurse up front. We saw about 5,000 patients, and 66% of those were seen by an RN and triaged in less than 15 minutes.
I really challenge any ED in the world to have as much information available to their emergency physicians as I do in my emergency department right now. I mean, you have the entire medical record in front of you.
I think some of the major improvements that we've accomplished is access to information, and that would be the patient's past medical history, their allergies, and their medications when they sign into the emergency department.
We find that that has been a huge satisfier for our patients. Just the fact that you can convey at any given time where you are in the process and give them reasonable expectations, not necessarily all positive in what they want to hear, but giving them an idea of what their course of care and timelines will be has been a huge win for us. And I think finally, the linkage of the patient with the physician more effectively leveraging technology, we felt like that model that ED PulseCheck brought to the table was the right fit for us at Inova.
By tying clinical documentation with charge capture and coding, revenue can improve dramatically.
We realized a difference immediately in the patient billables, and then we anticipate the net revenue. And if you multiply that times our anticipated number of treat and release patients for the coming year, that's where we got to the $3.2 million in additional revenue for the facility.
Since we've deployed ED PulseCheck, we've seen a gross revenue increase of $600,000 and a staff labor decrease of $225,000. And that was just over the past year, actually.
Now we can document our medical decision-making in a manner that our coders can actually read and see, and then account for our billing.
Picis ED solutions help clinicians and administrators find the information they need fast.
Our institution is all about connectivity. We have 350 physicians within a multi-specialty group that are using a single electronic medical record, and we have now tied that electronic medical record to the ED PulseCheck record.
We have over 2,000 users, but actually only 500 employees of our emergency department. So that means a lot of other departments like using our system for the reporting features as well as for tracking of the patients.
The system of PulseCheck gives you the tools, gives you the ability to implement change, the ability to change culture, to actually improve upon some of the things.
Since we've deployed the ED PulseCheck product, we have seen a decrease in our overall length of stay, which does mean that we have become more efficient in our workflow.
I feel like without ED PulseCheck, there's no way at all that I would have the data to make the decisions and really, empower people to make change and do all the things that we've been able to do.
There's one system that helps reduce wait times, boost throughput, enhance patient satisfaction, and improve charge capture and clinical documentation. It's called ED PulseCheck. From Picis,